More and more men are signing up for plastic surgery as they face increasing competition from younger men, both professionally and personally. But as the popularity of these procedures grows, it's important to know the differences between them. Here to share with us the top surgeries and what men need to know is board-certified plastic surgeon Dr. Anthony Youn. Dr. Youn, thanks so much for being here with us today.
Thank you.
So over 1.1 million men had elective cosmetic surgery last year. Is that right?
Yes, and so every year more and more men are having plastic surgeries done. And so one of the things we're going to talk about today is what's the difference between having work done as a man versus a woman. And really, even though more and more men are having work done, 90% of our patients are still women.
Right.
And these procedures typically are based off the feminine form, the feminine figure. So what do plastic surgeons do now to change things up so that we don't perform a female surgery on a guy?
Which is certainly not anything I'm sure a guy would want to have done. Now, what would you say is the biggest thing that men should be aware of before deciding to have plastic surgery?
Well, the biggest thing are scars. And, you know, there's no surgery that can be done with no scars at all. What we're going to talk about today, though, are 3 procedures that we can do now with no visible scars. So there's no such thing as a quote-unquote scarless surgery, but there are hidden scars and scars that you just plain can't see.
And why are scars more of a concern for men than women? Is that because they have less hair to cover?
Yes, exactly.
Okay.
So all the facial surgeries we do typically, we try to hide the scars in different areas. And a lot of times we can hide the scars in women because they have longer hair.
Right.
Well, with guys, our hair typically is shorter, and a lot of us are bald. And so it doesn't allow us the ability to hide some of these scars that way.
Right. All right. So we're going to talk about the top 5 procedures for men. Okay. What is the top?
So the first thing we'll talk about today as far as facial surgeries is rhinoplasty, or nose job. And that's the most popular facial surgery in men. And what we typically do now in men, in the past what we would do is perform a surgery where we would have scars on the bottom of the nose and on the inside of the nose. The problem is these scars can be visible. So the way that I'm doing my rhinoplasties now, the scars are all hidden on the inside of the nose.
Is that how you do it for women as well, though? Because scars
in general, a lot of women, too, we can do it that way. And it depends on how much needs to be done.
Right.
But if you have somebody who has, say, a bump on the nose, what I can do is make an incision on the inside on each side, and I can use a file like this. And it's like a nail file.
Oh, yeah.
And you can actually then file that bump down. No visible scars. The surgery takes about 2 hours. Recovery is maybe a week or so.
Fantastic.
And nobody can tell you've had it done unless they look somehow inside your nose.
But for a week you have to have the big bandage on, or no?
For about a week, you have a little splint on your nose. Okay. Typically the splint comes off at about a week. If the nose needs to be broken to thin it out, then a lot of people will get some bruising from that. You get the shiners.
Right.
If you don't need to break the nose, you take it off a week later, and a lot of people look perfect.
Fantastic. Yeah. And what is the second most popular procedure for men?
Well, as we age, men and women develop puffiness or bags under their eyes. And the traditional way to treat it, we would make an incision underneath the eyelashes and remove the fat, the puffiness. Well, what we're doing now is I can use a little instrument like this. And basically what it is it's a little eyelid retractor. I can actually, while a patient is asleep, open up the eyelid, make an incision on the inside of the eyelid, and take that puffy fat, the bag, out from the inside. No visible scars at all. I tell patients, if your friends think you may have had work done, tell them to get a magnifying glass, take a look in your eyes. No scars at all.
But that sounds a little bit more painful than the other.
Actually, it heals much faster.
Really?
Because it's the mucosa, and the mucosa heals much faster than the skin. It's like if you get a cut on the inside of your mouth versus one on your cheek. The inside of the mouth heals so much quicker. It's the same thing with the eyelid surgery.
So what is the recovery time for that?
Typically, people look great within a week. The surgery takes maybe an hour, hour and 15 minutes.
Wow, it's getting faster and faster, all of this.
Yeah, so things are getting better.
Yeah.
And then the final thing, it's funny, I have women come in to see me for consultation. A lot of women wear bangs, and they wear bangs a lot of times to cover up the wrinkles of the forehead. Well, men, we wear goatees a lot of times to cover up a weak chin. And so one good surgery that we do to help project the chin in men to give more of a masculine look is a chin augmentation. And we can do it using an implant like this. And this is a solid silicone implant. And
it won't move around?
It doesn't. It sticks right in place. In the past, we make an incision underneath the chin to place the implant. That creates a scar under the chin. Now I can actually do it from the inside of the mouth at the bottom of the lip, make an incision through there, put the implant in. The scar is hidden on the inside of the mouth. The great thing about this is it's completely reversible. You don't like it, you take it out 5 minutes later.
What about, I know that some men would like to have a more defined jawline. Can you do that for the whole jawline?
Same type of thing. Some surgeons put implants like this in the jawline. I've used fat before. And the interesting thing is this is the exact opposite of the surgery that I had when I was a kid, where my jaw was broken and actually set back. this is one way to actually set it forward to give more of a chin. I talked about that in my book and stitches that we'd mentioned before.
Right. Well, chin's something that's dear to your heart, right?
Definitely.
All right. And what is the next most popular?
Well, now we're talking about body surgeries.
Yeah.
And in women, body surgeries are typically meant to thin them out, to give more of a slender figure. But that's not enough in men. In men, we're looking for definition. So instead of a flat tummy, we want ripped abs.
So they don't want to just be slender. They want to see definition.
Exactly.
But they want to see muscle definition. So how can you do that with...
So what a lot of, well, not a lot, what a handful of plastic surgeons are doing is called high-definition liposuction. And there's a Dr. John Millard out in Colorado who's the pioneer of this in the United States. And what they actually do is they use an instrument like this. And this is the VASER ultrasonic liposuction system. And we can actually use this to help sculpt the fat of the tummy with the muscles underlying to create literally a six-pack.
Oh, my goodness.
And they're very successful.
But it's a six-pack of fat, not of muscle,
that's
right?
That's connected to the muscles underneath.
Okay.
And the idea is that helps to create that definition people are looking for.
Wow.
This is not a surgery that I do. It's a very advanced surgery that a handful of plastic surgeons who typically train out in South America do here in the United States. It's expensive, though. We're talking $18,000 for that six-pack.
Yeah, I might want to just hit the gym for that six-pack.
So, I mean, how many $1,000s is it for each pack of the six?
That's right, that's right.
So I'm going to show you how this machine works. It's an ultrasonic cannula, and we can actually melt fat. And we've got some Crisco here.
And that's the same consistency as human fat?
Exactly. And you can kind of see as I turn this thing on, some of the fat kind of, kind of creating a little bit of the Crisco, the white Crisco in the water here.
So once you melt the fat with that machine, how do you then suck it out of the body?
It's the same type of a liposuction cannon that we would. So the idea behind a machine like this is you melt the fat. It helps create a smoother surface because the fat's liquid when you take it out really helps you create and sculpt that six-pack.
Fantastic.
Like I said, a very advanced surgery. Not a lot of surgeons in the country do it.
All right.
Dr. Millard being one of the big ones.
Dr. Youn, thank you so much for all of this very important information. And for more on this topic and others, you can log on to the health page at abcnews.com.